Opioid addiction isn't picky. Good morning. My name is Imani Wiggins, and I will be sharing with you all the impact opioid abuse can have on the LGBT community. As someone who identifies as bisexual, it's important for me to research this topic. I was shocked to find that the LGBT community is often not spotlighted enough when talking about the current opioid crisis going on in America. The LGBT community is heavily impacted by opioid use due to a feeling as if they don't fit in anywhere, as well as the discrimination they may face daily on being considered a sexual minority. People are known to often use negative things to cope with that torment them. A survey conducted in 2015 showed that prescription drug use affects up to 12% of those who belong to sexual minorities. Vicodin, Percocet, fentanyl, and Oxycontin are commonly abused drugs. The long-time use of opioid painkillers often find themselves feeding for a stronger fix and tend to turn to harder substances such as heroin. Many heroin users have expressed they abuse painkillers prescribed to them by their doctor before turning to heroin. According to Dr. Sanjay Gupta, today's typical heroin addict starts using at 23 and is more than likely to live in affluent suburbs, and was likely unwillingly led to heroin through painkillers prescribed by their doctor. Being addicted to painkillers from prescriptions is the easiest way to become addicted to opioids. These individuals probably never thought they'd become heroin addicts. The chart provided by Ambrosia Treatment Center located in South Florida shows individuals of the LGBT community are more than likely to abuse prescription painkillers than their heterosexual counterparts. Heroin is a cheap, dangerous street drug because it poses a higher risk for overdose because it often has traces of fentanyl, a synthetic opioid, in it. The high that these individuals who use heroin feel is short but fleeting, causes them to use the drug more. Opioids are the deadliest drug type. At least 71.76% of overdoses, according to the National Center for Drug Abuse, is due to opioids. Prescription opioid painkillers are 40 times more than likely to become addicted to heroin. According to the National Institute on Drug Abuse, deaths due to heroin overdose increased more than six-fold between 2002 and 2015. When using illegal substances such as heroin, the individual becomes vulnerable to contracting diseases such as HIV, hepatitis B, and C. Opioid abusers become vulnerable to these diseases from injecting themselves with dirty needles. It is estimated that people who inject drugs are 22 times more likely to acquire HIV than among the rest of the population. However, even if the individual snorts heroin, it is still possible to contract a disease such as HIV because those under influence may partake in risky behavior to get their fix. As you can see in this chart above, 22% of injectable drug users have been affected with HIV ages 13 and up, while only 15% of black sober gay men live with HIV. A closer look at HIV. Gay and bisexual men are more at risk for exposure to HIV. In 2019, 65% of new HIV diagnoses were in gay men, bisexual men, and according to the CDC. Gay and bisexual youth often feel worried about being discriminated against for their sexuality when seeing a healthcare provider. This only increases the spread of HIV because people aren't getting tested. What can be done at home? Parents need to educate themselves on opioid use and its effects and also spread that information to their children as their children get older. Another thing to consider is also accepting their children for their sexual orientation. This could also lead kids away from the path of turning to opioids to soothe their pain. It is important doctors drop their biases when treating every patient. This can help lower the rate HIV and other diseases are spread. No one wants to go anywhere they will be judged or discriminated against, especially by someone who was supposed to help them. What works for you may not work for them. It is important individuals looking to recover from their addiction choose programs that are tailored to their specific needs and trauma. Examples of treatment would be behavior therapy, methadone treatment, group therapy, and rehab. There are many different options for treatment with those seeking treatment. The most common form of treatment is medicated assisted therapy. Medication assisted therapy provides a drug called methadone. Methadone is in fact an opioid but is a lot weaker than heroin, and doctors prescribe to their patients to wean them off of harder substances. In addition to being treated with methadone, those individuals are also expected to participate in behavior therapy sessions to get to the root of their addiction. In conclusion, there is a life outside of opioid addiction for those individuals who do identify as LGBTQ, but it's important those individuals seek help for themselves, such as behavior therapy or even try group therapy, because this could connect them to people just like them. I hope this presentation shined light on the dangers of opioids and how they can affect the LGBT community. Thank you for your time.